Welcome to It Starts Within, a podcast from Platinum Performance, where we'll dive into the health challenges faced by veterinarians and horse owners alike. Join us for inspiring stories about the latest advancements in equine care, treatments, and comebacks. You'll hear interviews with elite competitors, innovative researchers, and the veterinarians that devote their lives to horses and the humans that love them. At Platinum Performance, we know the power of nutrition starts within. Hello, all, and welcome. I am Jessie Bengoa, and I'm so happy to have you here with me today to examine today's topic with a man who has helped spur scientific advancement and clinical technique, all for the benefit of stallions, mares, and those coveted foals. We're talking equine reproduction today, and specifically aged mares and problem mares that tend to have some challenges in the breeding barn. We're going to dig into all of that with him. And to guide us through this ever-evolving world, I have with me a man that's not just a dear friend of ours here at Platinum, but he's a game changer in equine reproduction. And that is Dr. Pat McCue. Hello, Dr. McCue, and welcome. Thanks for being with me today, sir.
Hello to you, and thanks for having me. Pleasure.
Oh, the pleasure is all mine, and I can't wait to dig into this subject with you.
All good.
And ladies and gentlemen, for a little context on just why I've invited Dr. McCue here to give us the latest and greatest on this subject, he's the boarded theriogenologist at the helm of the widely respected equine reproduction lab at Colorado State University, which, by the by, is one of the most highly regarded equine veterinary programs in the world. And he's authored or co-authored over 10 books on the subject, over 400 publications, textbook chapters, scientific proceedings, or abstracts. And he has a list a mile long of accolades that the profession has deservingly bestowed upon him in recognition of his immense impact on reproduction. And I've just made him very uncomfortable, but I can brag on him. It's my show. I can brag on him.
Right.
And not that you need more, but he was also last year's AAEP Frank J. Milne State of the Art Lecture, which is an honor given to the worldwide authority figure on a given subject. And on top of all that, he's just a really good guy. And I'm so looking forward to digging into the intricacies of aged and problem mares with him. So, Dr. McCue, let's roll right into our subject at hand, shall we?
All right, I'm ready.
Ready to roll. Okay. So, as I was thinking about our conversation this morning, I remember talking with Dr. Ricky Carcula down at Brazos Valley Equine in Texas last year. It was actually preparing for your Milne lecture because we get to do Platinum has sponsored the Milne lecture for 20 plus years, and we get to do this really amazing, get to have the amazing opportunity, rather, of producing a video to honor the Milne lecture. And so in doing that for Dr. McCue, we got to talk to Dr. Carcula, and I thought she made a great point on this particular subject. And it seems so obvious, after she drew my attention to it, but she said, essentially, look at all this progress we've made in terms of longevity with the horse. They're living longer than ever before, thanks to improved veterinary medicine, nutrition, conditioning, recovery protocols, all the things. But with that comes challenges in the breeding barn as we have older mares that we're trying to breed. And I thought that was a great point that she made, kind of a light bulb moment, even though it seems so obvious. But are you seeing more and more older mares? And what are some of the most common conditions that you encounter in both these aged mares and mares that may be younger, but they're experiencing fertility issues? What do you see?
Yeah, I'm going to address them as two different groups. One, we'll go with the aged mare first, and then we'll go with as you suggested, the younger mare. I'll just say anywhere from 4 or 5 up to 12 or 13 that have some reproductive problems. So we'll start with the older mares. It used to be when a mare got into their late teens, you'd start thinking about, well, it may be time to retire them because of a number of issues that come up. And we see aged mares in two different fronts, really. We see the mare that's been a brood mare for a number of years, and she's doing okay, but now she's hitting her later teenage years. And so I always talk about the reproductive plateau of the mare as starting around age 4 and out to about age 14 or 15. And there's a slow decline in fertility potential from about that 14 or 15 down to about 20, and then a more rapid decline in fertility potential from about 20 to the end of their reproductive career. And by fertility potential, I really mean the ability of the mare to get pregnant and to stay pregnant and deliver a live, healthy foal. And so we see that shift in relatively easy to breed a mare, relatively easy to get her pregnant, and she's going to carry. And that starts to change. And we need to be ready for that shift in the second half of their teenage years. And really, when they hit 20, they are much more challenging they don't cycle as well. Some mares don't ovulate as well. Early embryonic loss is higher. And some mares just don't have the ability to carry. And that brings us to the opportunity for assisted reproduction in there. With assisted reproduction really means anything from artificial insemination, embryo transfer, and the newer aspect of ovum pickup and intracytoplasmic sperm injection. That's really prolonged the reproductive lifespan, if you will, of some of these older mares, because with embryo transfer, for example, we can flush an embryo out of a mare that's reasonably healthy. They've got to be reproductively healthy in order to ovulate. Fertilization has to occur. The embryo has to traverse down the oviduct, which takes about 6 days, more or less. And then it has to enter a uterine environment that's normal, that's reasonably normal, and has to survive in there for a day or two before we can flush the uterus and get out that small, about a 0.5 millimeter, more or less, embryo and transfer that into the uterus of a younger, reproductively healthy recipient or surrogate mare. And that's extended the reproductive lifespan of a lot of mares. And that's been done for decades, since the 1970s. And the upswing in embryo transfer happened in the 80s with a lot of early discoveries, and then really increased in the 90s. The other type of older mare that we see is the older mare that's never been bred before, a maiden mare. And there's a couple definitions of the word maiden in the world of equine reproduction. One's a mare that's never been bred, and then the other one is a mare that's never carried a foal to term and given birth, and they're quite different. And we see a number of, and everybody else does too, a number of older maiden mares that have been in reproductive training and performance until they're 16 or 17, maybe even 18 years of age, and an owner finally decides it's time to retire the mare from competition and start a reproductive career. And for any veterinarian and breeder that's in that world, a red flag will come up immediately, and they're going to go, oof. There's going to be some potential challenges. And an older maiden mare is not the same as that mare would have been when she was 4 or 5 or 7. And the biggest concern of that is cervical function. And these mares have a tendency to not be able to relax their cervix. We can inseminate them, but they tend to pool fluid in their uterus, and we've got to work with that. The other thing about older mares, their eggs, their oocytes, have changed over their lifetime. Unlike stallions, who constantly make new spermatozoa, spermatogenesis about 60 days, and stallions are constantly making new sperm throughout their lifetime. Mares are born with every egg, every oocyte they're ever going to have. And so over the course of their life, those eggs can age, and they can have some issues, some chromosomal DNA issues with that. And some of the older mares may have some issues with their oocytes, and they're not all equal. Each oocyte is probably going to be different. And on some cycles, they may have good fertility, but on other cycles, experience early embryonic loss. So older mares are a challenge, and but with challenges comes opportunity to learn, opportunity to try different techniques and different ways to get a pregnancy for an owner.
I love that. I mean, it's a world of possibility now that it wasn't necessarily over the past decades. And what I'm hearing from you also as you're explaining this is, gosh, there's a lot of parallels with human medicine, as it always is with equine medicine, but there's such a parallel here. And I know that a lot of the work coming out of your lab, and Colorado State in general, by the way, I mean, you all are so advanced in terms of what they call translational medicine, or equine to human and back again. that there's probably a lot more going on that can actually transfer right over to humans as well.
The history of that really started with Dr. Bill Pickett, and back in the 1970s and 80s. He was a big force, especially in the world of stallions. Then Dr. Squires came, and he really pioneered the embryo transfer part within the United States and made it commercially viable. Ed deserves a lot of credit for that. Elaine Carnevale came on. And she was one of the early proponents of oocyte collection and ICSI. The very first ICSI, just oh by the way, Dr. Squires back in it was 1996 when the first foal ever born by intracytoplasmic sperm injection was born at Colorado State. That was really due to Dr. Ed Squires, and the parallel with humans, and it's an interesting story, and I'll make it brief. Ed was interested in oocyte collection and ICSI, and we brought somebody in to do the ICSI for us because we didn't have anybody at the time to do that. And we brought somebody in. We collected the oocyte, and this person did the ICSI and transferred that into the oviduct of a surrogate mare, and she got pregnant, stayed pregnant, and carried and gave birth. But the interesting story to that was that the individual that we brought in was from a human fertility clinic. And the backstory to that, which is the most interesting part, is that he had been trained at Colorado State University in animal science. And so he went from animal science to human reproduction, and then we brought him back to do the first ICSI ever in the world. And yeah, the circle, it just goes around. So many of the techniques that have been used in equine reproduction have been developed early on in mice models and other models, sheep models. Translated humans, and then often brought back to the equine world.
I remember at the very first Platinum Summit in 2019, it was actually in Denver, kind of in your backyard. And I remember Dr. Carnevale, Dr. Adam Chico, and Dr. Rebecca Kreischer, who Dr. Kreischer is on the human side as well. And she comes from, one of the premier human fertility centers in the world is in Denver. And she comes from there. And they gave this fascinating talk, that was all about translational progress that had gone on. So kudos to you and your team, because you all do certainly some amazing work. And that's Dr. Carnevale and Dr. Hatzel and Dr. Chico. And you've got the dream team.
It's got a great group. Yep.
You really do. So let's talk about, kind of to take a 30,000-foot view on equine reproduction. Talk to me about some of this evolution. And you've already touched on it a bit, but this is an area of equine veterinary medicine, like so many, that has evolved tremendously. And completely changed the game in terms of what's possible, in breeding these mares that may have never been a possibility before. These stallions, everything that you all deal with. So talk to me about that evolution and what is in your toolbox now, and how, looking at the horse world, you've made it possible to continue these bloodlines that would have, been a cease and desist at that point. So now things are different.
Yeah, I just want to make sure everybody realizes that we aren't the only group that is involved in this, that there are places all over the U.S. and all over the world that advance the science of equine reproduction, and we all learn from each other. Just a week ago at the AAP, I sat in the audience taking notes from other people around the world saying, they're doing this, and maybe we need to incorporate that idea, that concept. And even though we have a set of skills and we have a more or less a set way of doing things, we learn from everybody else. And that's why we love going to these meetings and having communication with everybody. It's in the world, the group that works in equine reproduction, it's really a small group, and we all know each other pretty much, and again, learn from each other. And so if I were to take a step back, when we get a client in that has, I'll just say a couple mares, and they bring them in, and we'll have a conversation first about what the goals are. And many times, the most common thing, the goal is to breed a mare to carry. And we'll get a history. That's probably the singular most important thing, is to get a history on the mare. And sometimes it's, I'd never bred her. And we'll We'll figure out, how old is she, what the stallion is, and what their goals are. If they're going to breed to carry, as in carry their own pregnancy and give birth, then we shift to that mode. And I'll get to the other ones in a moment, but we'll shift to that mode. And on a younger maiden mare, we may not have to do very much. We may give the mare the benefit of the doubt, if you will, to say if she looks healthy, and on the initial physical exam of the mare, looking at the whole mare, then focusing in on the reproductive part, ultrasound exam. And if everything looks okay, we may just go ahead and say, okay, we'll give her a chance here. And often in our world, most of the mares are going to be bred by artificial insemination. So we'll know in advance the semen collection schedule for the stallion. We'll set the mare up to, as she comes into heat, we'll know that the stallion is collected every other day. And we'll set the mare up so that we can order semen, have it arrive, inseminate the mare, probably give her a medication to make sure she ovulates on time, and then do a 14-day ultrasound exam after she ovulates to see if she's pregnant or not. And young mares have, if they're bred to a fertile stallion, they probably have anywhere from a 50 to 70+% chance of being pregnant on any given cycle. Now that's going to change as a mare ages. And so the young mare carrying her own is probably the most straightforward opportunity for reproduction. Sometimes if we get a load of older age mares that have reproductive problems, sometimes I'll, tongue in cheek a little bit, ask the owner, can you bring me just one normal younger mare so I can feel good about myself as we're trying to get pregnancies? But other people may bring a mare to us that's got a little age on her. And for embryo transfer, we'll start with that. And they may have a list of stallions, and they may say, we want an embryo from this stallion first, and maybe a second stallion, and the list may go on for other possible stallion opportunities. And my words are usually, let's try for one. Let's be happy if we can get one pregnancy ongoing before we're going to have a litter of foals here. And so some of these older mares, we really have to take a step back, if you will, to say, okay, now, does she have a history of productivity? Have you been able to get pregnancies from her? A really important thing in my mind is, when was her last foal? And if she had a foal last year, and now we're coming into the next new breeding season, that mare's got a higher likelihood of being a successful embryo donor or carrying her pregnancy than if the words were, well, she's been open, she's 17, she's been open for 5 years, and we may or may not have been trying in the meantime. And if they have been trying every year for a few years, again, I always say this, a red flag goes up in my mind going like, okay, now we have a different kind of mare than the more straightforward one. So we're going to take a closer look at that mare to try to figure out the why part. Why wasn't she able to get pregnant in the past? And before I forget to say this, one of the challenges that we see fairly routinely almost every year will be somebody that brings a mare in, and they may say, all of last year, we bred this mare, artificial insemination, to stallion X. Maybe 2 years in a row they bred because they've got a contract on that stallion. And I'll just have a very direct comment to the owner that the first thing that I'm going to recommend is to change stallions. And often that's enough. That the genetics that's an understudied area, but that we can breed a fertile mare, one with good fertility history, to a known fertile stallion, and either not be able to get a pregnancy or establish a pregnancy that fades away, early embryonic loss. And that may happen a couple times in a row, a couple cycles in a row. Simply changing genetics. Changing the genetics of the stallion that we breed this mare to is enough to gain a pregnancy that the mare can carry, or get us an embryo that will survive on transfer. So,
Dr. McCue, I feel like Dr. Carrie Finno at your alma mater, UC Davis, is over there like, just let me at it. Her genetics.
Yeah, it's all about genetics. I know she says that at the AP. It all comes back to genetics, and for to a large degree, she's correct. So we have to address that, and then and if we get to change stallions, then we start on the list of what are the other possibilities. And age mares have a list of very common things. And one of the more common ones is their uterus is aging. And so an older mare is going to have on ultrasound some visible lymphatic cysts, the kind of cysts that you can see on ultrasound. And it's not the cysts themselves necessarily that are the problem, but the underlying cause of the cyst, which is fibrosis in the uterus. And by seeing if it's just one or two small cysts, it would suggest to me that the fibrosis is mild. But if they have many cysts, and some mares will have more than a dozen medium to larger cysts in the uterus, that'll tell me that their uterus has a lot of fibrosis. And if we took a uterine biopsy on those mares, it would probably come out in a grading scale, grade 1 being a normal, healthy uterus, grade 2, 2A, 2B in the middle, and grade 3, a poor uterus, either from fibrosis or from inflammation. And this we can often get an idea of what the biopsy would show just based on an ultrasound exam. And sometimes that will tell us that the mare is less likely to carry a foal, and we should be discussing embryo transfer with that owner. That'll be followed by the ultrasound, followed by a culture and cytology. Mares are well known to be able to have endometritis, which could be infectious or non-infectious. And there are four main bacteria that we look for: Streptococcus, E. coli, Klebsiella, and Pseudomonas. And Streptococcus by far being the most common one in horses, but aged mares, often it's either strep by itself or strep and E. coli. And so not a surprise if a mare comes up with that, especially if she carries a little fluid in her uterus. Uterine cytology is important, and that's where we take a swab or a brush up into the uterus and get a sample of the cells that line the uterus, and we look for inflammatory cells. If we have a positive culture and inflammatory cells of the uterus, then it's really telling us that, yeah, there is active inflammation caused by bacteria, and then we'll have to treat that. We really recommend that those type of evaluations be done prior to the start of the breeding season so that we take care of those issues and before saying, okay, now the mare is going to come into heat, the breeding season has started, it's mid-February or later, and we don't really want to waste any time. So we try to do all of that early.
You're behind the 8 ball at that point.
Behind already, and we hate to miss the cycle. And in some breeds or disciplines, the breeding season can be quite short. In some of the quarter horse and thoroughbreds, by the time you hit June, the mares are just getting up to speed. They just started cycling normally, and already the breeding sheds are starting to shut down. So we really have a limited opportunity on some of these mares to get a diagnosis and get them bred and either get a pregnancy or get an embryo.
I feel like that seems, and you can tell me, the work is probably already out there and ramping up, gaining speed. But as you were talking about, the uterine environment and that urogenital microbiome, essentially, gosh, it seems like that also translates right over to humans. And, that's huge.
A huge change in concept here. I've been a veterinarian for 38 years, and what I learned and what I unfortunately told generations of students is that the uterus is a privileged site. There is no normal bacterial population in the uterus, and the more people have got into in depth in the microbiome and doing studies, your next generation sequencing from uterine samples, it turns out that there are bacteria in the uterus. And so is there really a normal population of bacteria? It's still debatable, but the answer is probably yes. When other species have been looked at, they find similar things, that there are bacteria that are not pathogens, but that are associated with the uterine environment. So yeah, every time we get better diagnostics, we find out things that it changes the way that we have thought about things. So that's an interesting new facet, the whole microbiome, and how the GI, the oral and GI microbiome will affect the reproductive tract. I do want to mention one other thing, and that is part of the reproductive evaluation I think is underappreciated when people do a physical exam on the mare, is the perineum of the mare and how important the vulva of the mare is in preventing ascending is the word, ascending uterine infections. And it's really the confirmation. Are they tilted? The vulva should be relatively straight up and down, relatively vertical, and have good muscular tone to it. And something as simple as putting in a Kaslik procedure can prevent the mare from having a bacterial infection, or prevent it from getting reinfected and allow her own immune system to take care of the infection that she has. So
So
yeah, there's so much more technology out there than we ever have. A video endoscope, for example, to be able to put an endoscope up through the reproductive tract of the mare, through the vaginal wall, to look at potentially lesions in the vaginal wall, like a varicose vaginal vein. The cervix, is it normal, or during the last foaling, was there a physical injury to the cervix, which may limit her ability to prevent bacteria from getting up into the uterus? Going up through the cervix into the uterus, looking for things like uterine cysts, which we can see on ultrasound, but scar tissue. Sometimes we can see adhesions in the uterus, or other aspects that we weren't able to do before. So there's so much technology out there now, and yeah. Anyway, it makes
that's
me
what,
yeah
that's
it
what
makes
makes
me
you.
yeah I'm just excited to be able to utilize all of that.
Well, 38 years later in your career, I think that's something that keeps it fresh and exciting, and
Yeah, yeah,
massive progress. And I love it. Most people think of an endoscope going down the esophagus, but this is just up the other end.
just
And
the other end. Yep.
you can see all kinds of interesting things. And one thing, as you were talking about a lot of the cases that you all work on at Colorado State, is it seems like, and correct me if I'm wrong, but it seems like these centers of progress, some of it is more geographically dependent, because if you go to somebody like a Dr. Scoggin or a C. Scott Bailey or a Von Dolan or a Lou back in Kentucky, they're dealing a lot more with live cover, obviously, in the thoroughbred world. So that's probably a whole nother realm, of progress that's going on back there.
Right. Yeah, they've got their own set of challenges, because obviously in thoroughbreds that they have to carry their own pregnancy. And I work in a world that is largely quarter horses. We see a lot of warm bloods as well, but in our world, most of the mares, as I said, are going to be bred by artificial insemination, and we have the option of embryo transfer, and we have the option of oocyte collection and ICSI. To generate pregnancies. And so I can appreciate, my heart goes out to them sometimes when they have an aged mare that she just has to carry, and that is her reproductive role, is to carry, and not and their hands are tied a little bit. They also do a lot of other work in other breeds, so that they can do the AI and embryo transfer and ICSI on other breeds. But yeah, more of a challenge in thoroughbreds, that we can bypass a lot of that. And with embryos and with ICSI, part of the reason for developing those is for those problem mares, essentially to bypass a uterus that is not very healthy. And again, just a small repeat. For embryo transfer, the uterus has to be healthy enough that an embryo can survive for a couple days. And if it's an unhealthy uterine environment, an active bacterial infection is just one example, that won't work in that mare. The embryo just won't be able to survive even probably a few hours in that type of environment. And that's largely the impetus for the oocyte collection and ICSI. It started out as really maybe bypassing an abnormal uterus. And so you could go up into the ovary, an ultrasound guided needle going up into the follicle and aspirating out the follicular fluid and the oocyte, maturing it in a petri dish, and then doing ICSI. But then it became an add-on of, well, what about the stallion? Some of the stallions that have either limited amount of spermatozoa, or if they're frozen semen, some of these stallions that have passed away and there's very limited amount of frozen semen, then sperm injection can be used to optimize the use of that limited amount of frozen semen. And people like Dr. Carnevale, Dr. Catherine Hendricks, and many, many others around the world have pioneered taking off a tiny little bit of the straw frozen semen and thawing that, preserving the rest of the straw, keeping that frozen. And so you can utilize the semen of a stallion very efficiently in that regard. Then that has morphed on to, interestingly, over the last, I'm going to say 3 to 5 years, where normal young mares have been collected, the oocytes collected on a relatively routine basis, and being able to get a half a dozen or more oocytes from a single collection, sometimes quite a few more than that, maturing them, and then doing ICSI, and then if embryos form, freezing them, cryopreserving them, vitrifying them, and then later on you can transfer them whenever you want, as long as they're like sperm, as long as the embryo ICSI derived embryos are frozen. You can hold them for potentially years, many years. So then one of the biggest challenges has been some places have stockpiled a number of ICSI embryos in liquid nitrogen tanks through the late summer and all fall. And now once the breeding season starts, then they are thawed or warmed and transferred into recipients. And one of the biggest challenges is, where do you get enough recipients to handle all the embryos that are now stockpiled in liquid nitrogen tanks around the United States, around the world?
You need a
It's
lot.
changed.
You need a lot of
Yeah, it's dramatically changed. Yeah.
Oh my gosh. Well, we just wrote an article in the latest issue of Platinum Magazine on recip mares because that's a whole nother thing. They're not
Yeah.
just a vehicle. Again, it's like, paying
Correct.
attention to the health
Yeah.
of recip mares because you might have this extremely valuable embryo. And if it doesn't take in a recip mare, then you're back at square one. So,
Right. Most
all
of
of
us
it's
have said
important.
for years, I apologize for interrupting, but that the recipient mare is often the key. It's one of the most important parts of a assisted reproduction program, be it embryo transfer or ICSI. To have a healthy recipient, then people need to take care of the recipient mares just like they would the donor mare. And you can't. It used to be that the recipients would be treated, like as you kind of said, like a vehicle. That it's just a uterus, and it's so much more than that. And so, from a nutrition standpoint, from a general health standpoint, vaccination and deworming and foot care, dental care, those recipients are a tremendously valuable part of a reproduction program and need to be treated that way.
Yeah, absolutely. 100%. And you answered the question before I could even ask it, which was another, I feel like I'm beleaguering this, but it's so fascinating, the translational aspect of this, where, women across the country and around the world are freezing their eggs because of
Right.
career choices or whatever it is, they want to be able to have children someday and they want to be able to freeze their eggs when they're younger, when they know that that could be a more fruitful process. So it's really interesting the parallels that go on in these two worlds.
The freezing of the eggs or oocytes is still in its the relative infancy in that regard in the horse world. I believe the first foals born from frozen or vitrified oocytes, again, not to, it was at CSU, I think in 2002, Lisa McClellan and Elaine Carnevale froze vitrified oocytes and were able to generate embryos and then from ICSI and then transfer them into recipients, resulting in the birth of live foals. And I know that there are people around the world working on that, but one of the challenges with that in any species, but in the horse, an oocyte is one cell. When we freeze sperm, maybe let's just say we freeze 1 billion sperm at a time as a breeding dose. Often it's 800 million, but let's just round it off to a billion. If 15% or 25% of the sperm don't survive the freezing process, you still have 700 or 800 million sperm that are alive. And with an oocyte, it's one cell. And if there's damage to that one cell, then after that is thawed or warmed, the that is challenging to foster a reproduction, successful embryo development in that. And so there's an area that needs a lot more research, because I think of that as maybe the next frontier of equine reproduction would be looking at better ways to freeze an actual oocyte.
Yeah, I mean, no pressure there. You got one and done.
Yeah, yeah. Well,
Um, I
One of
mean,
the breakthroughs, I'm going to interrupt one more time, and I'm going to do that a lot probably to you, and I
you go,
apologize.
Dr. McCue. We're here to learn from you, not me.
Once you get me going, I really can't shut it down. But I'm going to give kudos to Katherine Hendricks and her group at A&M and then at the University of Pennsylvania for really being the pioneers in true in vitro fertilization, putting oocytes essentially in a petri dish or a test tube, if you want to think about it like that, adding spermatozoa to that, and letting fertilization happen in vitro in a petri dish without sperm injection. And people are looking on that now as, again, one of the next frontiers in the world of equine reproduction to hopefully make that as a routine possibility. And we may be years or a decade away from that, but they've broken ground with that. Some novel things that they've done, and it may be a bit for a while stallion dependent and mare dependent, technique certainly dependent, but now that it's been done, true IVF pregnancies and live foals born opens up a whole nother world that we said, well, it's a challenge and we're not able to do it. Well, now that has been, it's been done, and we need more work on that, more basic research on that.
So, Dr. McCue, for the benefit of our listeners who may not have, had a horse that they've wanted bred or may not be super experienced in this area, can you tell me the difference between ICSI and IVF?
Right. So ICSI, intracytoplasmic sperm injection, where there will be an egg, a single cell oocyte. I'll just go back to in a petri dish in a droplet of media, and then a second droplet will have a number of spermatozoa in there that could be fresh, as in not ever frozen, or could be thawed sperm, but they're live moving sperm. And with ICSI, a single sperm will be picked up by an injection needle. I'm going to bring my hands up where you can see it. And that needle will be passed with little micromanipulators, passed passed through the outer investments of the oocyte, through the zona pellucida, into the cytoplasm of the egg. The sperm literally injected into that, and that injection pipette removed. So we're mechanically, if you want to think about that, putting a sperm inside the egg. And with natural IVF, in vitro fertilization, as we're going to define it here, because they're both in vitro fertilization, as in outside of the mare's reproductive tract, then the sperm itself will probably a number of sperm placed in proximity to the oocyte, and the sperm will attach to the oocyte and eventually penetrate in itself without any assistance. And so there's had to be breakthroughs of that, from maturing the oocyte, maturing the sperm, and getting it ready for its own innate ability to attach to an oocyte and then penetrate all the way through and get into the cytoplasm. It's fascinating how all of that has advanced.
It is fascinating to say the least, and thank you for that definition, because I think that's probably a common question is what's the difference? But
Yeah.
Dr. McCue, I want to focus on the Equine Reproduction Laboratory at Colorado State, and you made the point that there's a lot of centers of progress, across the country, around the world. But Colorado State really does have an impressive equine reproduction laboratory, of which you've been at the helm for many, many years. And tell me about the lab, because I think when a lot of people hear equine reproduction laboratory, they picture, a white sterile room and you've got all hunched over microscopes at all hours of the day. And there's a certain piece of it that's like that, but you also are doing a lot of clinical work and you're treating cases. And talk to me about what life inside the lab looks like, what your goals are, your team, and how progress is made.
Okay, so it developed over a period of more than 45 years. It's probably close to 50 years now. It started as a stallion program. And in the early days of the ERL, it was really called the Stallion Lab. And for probably 20 years, when somebody called and the person answering the phone, they would answer Stallion Lab. It wasn't the Equine Reproduction Laboratory at the time, because it was completely devoted to the world of the stallion, trying to everything from a number of sperm in the ejaculate to how many sperm it would take to get a mare pregnant. Just a lot of focus on reproduction of the stallion, and then it morphed into a mare program, and now it's a combination of mares and stallions and foals. And But we really have three responsibilities globally. We have a clinic, and we're very fortunate to have a good caseload and people that believe in our program that we see year after year. Like a lot of veterinarians will see their common clients, and we love that. We love seeing the same people, and a lot of it, I'm going to wing it and say 60-70% of what we do is basic reproduction. Maybe just pregnancy exams on mares that were bred at home, or breeding a mare just with insemination with shipped in cooled semen. And then 30-40% is going to be a much more advanced reproduction. We're a referral center, so we'll get cases referred to us from Wyoming, Montana, Nebraska. A lot of the West will utilize us as a resource for problem mares that are challenging to all of us. And that's one of the things that in my career that I kind of live for. I like the problem mares. I like the reproductive challenge, diagnostics and therapeutics. So certainly we have a clinic, and the clinic doing all aspects of reproduction, from basic reproduction and up to ICSI. And then we teach. And so we've got senior veterinary students that rotate with us. We also teach in the second year and the third year of veterinary school. We teach an equine sciences program. Undergraduate students will have rotations with us, do externships with us. We teach a class on foaling, care of the pregnant mare, the foaling process, dystocia, and care of the newborn foal. And we've been doing that for many, many years. We'll have 70 or 80 mares give birth in our program. And in the spring, it's such a wonderful place to be because we've got so much activity going on with foals being born, and people excited about maybe breeding a mare for the first time. And that's also a thrill for us to be able to help them. And on ultrasound, for them to be able to see a 14-day pregnancy that's 15 millimeters in diameter and say, that's your baby right there. So we do a lot of a combination of clinics and teaching. We run a continuing education program for veterinarians. It started really with Doctors Pickett and Squires, and we've continued those programs as well. We've got a very large continuing education course for horse owners that happens every January. And we go through the whole reproductive process of stallions and mares and giving birth and foaling, and all about trying to understand equine reproduction, what the role of their veterinarian is, and how they can work with their own veterinarian to help foster success in getting a live foal. Yeah. And then the research activity is the third prong of clinics and teaching and research. Again, typically we are either taking a clinical problem and trying to say, how can we better try to solve a diagnostic test, a couple things, and there's many of them, but better ways to culture mares and be able to diagnose uterine infections, and PCR, using some genetic tests for looking at the DNA of bacteria and fungal organisms, and then obviously the advancements in reproductive endocrinology, hormone therapy, embryo transfer, freezing embryos, and ICSI. Just there's constant work going on, and some of the new faculty working. Dr. Jenny Soames working on microbiome of horses, which really has the possibility of advancing things both diagnostically and therapeutically. So every time we go to a meeting, more questions come up, and we come back and huddle up and go, okay, what's going to be our focus in the next 2 to 3 years?
Yeah,
so
I
constantly evolving.
I love that about you all. I mean, going back to the beginning of our conversation where you were saying that you went to AAP and you're sitting in the audience taking notes, I can only imagine what that feels like as a presenter, being like, oh my God, Pat McCue is taking notes on my talk. But yeah. I think it's, you all inspire each other, and science moves on. And one of my favorite quotes is Dr. Marvin Beeman, who's just a legendary veterinarian who's just south of you all in Littleton. And he says, I wonder what's on the other side of the page that we haven't read yet, and medicine. And a lot of people have the misconception that in research, there's this sudden aha discovery moment. It's like, I've cured pick your ailment, ta-da. And
Yeah.
in most cases, it's not that way. Science builds on science. And so
It's often a decade of small steps
yes,
before you can have that aha
yes.
word. Yeah.
And we'll
Right.
talk a little more about that later because we're going to talk about some emerging research that came out in 2022. But the interesting part about that is it was based on research that was done, 12 or 15 years before that, And so I just think it's amazing how slow and steady wins the race in some cases, and in science, certainly that's the case. But Dr. McCue, if you'll humor me, I want to dig into one of those aspects, and it's obviously a world that we live in here at Platinum. And I want to dig into nutrition a little bit here because it does come so heavily into play with stallions, but certainly these aged and quote unquote problem mares that you're seeing. And let's talk about that research just a little bit that came out of your laboratory there with some of your colleagues, again, Dr. Carnevale and Dr. Giovanna Catandi. And side note, you all have really contributed to scientific progress in this world by the people that come out of Colorado State, because you've got a residency program and PhD students. And I mean, you've got Dr. Jennifer Hatzel and you've got Giovanna Catandi and you've got all these amazing people that go on to these other centers of influence or stay right there at Colorado State. And so that perhaps is your biggest contribution, is these brilliant people that come out of your program.
Right. Yeah, we've been fortunate to have a lot of people and we're talking now 30 or 40 years of graduate students. And then we built the residency program in the late 90s, early 2000s. And we've had quite a number of residents that have come through and gone into private practice as well. Dr. Ryan Ferris is
Yes.
one. And Dave Schofield is another one. And there's just many, many others that have spent time here, worked hard, done research projects, and advanced the science in their field and what they did. And Dr. Carnevale, Dr. Catandi, and others have done remarkably well with looking at nutrition and how nutrition has that how you feed the mare and what you feed the mare can alter the environment of the oocyte and the health of the oocyte and alter oocyte metabolism and potentially make that oocyte better able to be fertilized. And so that basic science has really changed things. Same way with the stallion. People that have looked at nutrition of the stallion saying, okay, can we make a healthier sperm and a sperm that are better able to survive cooling, sperm that are better able to survive the freezing process. So yeah, one shouldn't ignore some of the most basic aspects of horse health. That would be nutrition, but also just general health care, and which would include dentistry as part of nutrition.
100%. I mean, seems like such a simple concept, but it is something that is sometimes overlooked.
It's overlooked. You can't just throw hay at a horse and say it's good enough.
I remember Dr. Charlie Scoggin, who is a stallion, the stallion man back in Kentucky, and he always makes the point. He's like, hey, listen, I may be a theriogenologist, but I'm a veterinarian first, and these horses have to have good joint health. They've got to have good hooves. They've got to have all the things. If I have a stallion that's got an issue with its cervical spine or its back, we've got an issue, with a stallion that's required to live cover. So all the things go into it, and they have to be healthy horses first before they're good reproducers. And I remember I've been at Platinum for 16 years now and got to also grow up knowing, the late, great Dr. Doug Herthel, our founder, who was another visionary veterinarian.
Yeah, very much so, yeah.
And I remember, when I first arrived in, equine reproduction, the first study where we worked with Colorado State, really looking at nutrition and its impact on these aged and problem mares, when that was going on. And he would say, listen, in terms of from my perspective, there is no greater testament to the impact that nutrition can have on a horse's health than pregnancy. I mean, what a testament to how you're able to take a case and support it and necessarily turn it around. Than if you're able to get a horse bred, that way. So
right.
I always thought that was great. And he always got so passionate about that because he said, I mean, we all love good news, right? And there's no better news than that, to your point. And what they eat can directly impact that horse as a whole. But more specifically, excuse me, that developing oocyte and those embryos, but that metabolic function happening within those cells too. And, that goes back to human medicine again, where we're finding out that metabolically, there's so much to know in terms of the human and the horse. And that epicenter of energy within those horses' cells is so important to successful reproduction, but to long-term health and longevity as well.
Right. I like your word with Dr. Hertel as a visionary, and I think it's a very appropriate word for him.
Anybody who knew him, he certainly was a special man and quite the mind in equine veterinary medicine. But so yeah, that study that came out in 2022, I believe, that had Dr. Carnevale and Dr. Catampi at the helm, they really dug into that and they looked at all this targeted dietary supplementation in vivo and in vitro on oocyte function really could help support that developmental potential.
A groundbreaking study, and I think it'll be appreciated as being groundbreaking as time goes on. Like a lot of studies, it's one of a lot of studies that happen, and I think when people realize the impact of nutrition on oocyte health and on sperm health, it'll become more important and realized as more important as time goes on.
Yeah, 100%. Talking through all this with you, Dr. McCue, you have been in the business and the industry, immersed in this passion area of yours for, like you said, 38 years in practice, which is an impressive, amazing career. Are there certain standout cases, that you look at and say like, hey, I get to see a lot of cool stuff and I've accomplished a lot, but are there some that stand out to you, or is it all just this giant collective pool of really cool things you've worked on over the years?
Yeah, as I mentioned before, like a lot of veterinarians, and I am, if somebody asks me what do I do, what am I? And my answer is going to be, I am an equine veterinarian. First and foremost, I'm an equine veterinarian. And I've been fortunate to be where I am for 30 years at Colorado State, and fortunate in this program to be able to see a lot of really normal things, which really sets it really is the benchmark of it's not really the right word, but you get to know what normal really is when you've seen many hundreds of mares and stallions and foals over time. But then you get to see the not normal things, the fascinating things, the one you go, well, I didn't ever think that could happen. And there would be quite a lot. All of us would have those kind of lists. And at the AEP, I went to vet story night, and listening to the cases that people from around the country had and the stories they shared, completely fascinating. But we've seen similar things. And if I had to pick, oh boy, maybe one in particular of a lot of them, there was a horse that came in. It was a phone call that came in that an owner had a horse with a prosthetic leg, and they wanted to get embryos from that horse. Now this horse had a very severe injury to one of her front legs, and they had to amputate the front leg and put a prosthesis on the leg. And that horse had this prosthetic leg for, I want to say, 5 years. And I was going to, when I first heard that the horse had a prosthetic leg, I'm thinking, how many weeks had it been on? And she said, well, it was my dad's horse, and it was his favorite horse, and it got injured, and they've had this and been taking care of this mare for 5 years. And and it's just up in Wyoming, and we said, well, bring it down and we'll see what we can do, and completely not thinking that this was going to be something that we'd be able to help with. She brought the horse down, and this mare was amazing on how she tolerated that prosthetic device. We would have to take it off, clean it. But every other day we're doing this. And I think it was Dr. Melissa Prell that was a resident at the time, and now she's at Peterson Smith in Florida. But we had this mare for probably 3 months at our clinic. we got 3 pregnancies out of this mare from embryo transfer. 2 survived to term and in recipient mares and ended up as foals for this person. And if I had to pick one case that I thought, wow, this is going to be a challenge, and it ended up being just an awesome experience to help this person. We've had others. We had a tornado come through Colorado. We don't get a lot of tornadoes. We're a little up against the mountains here at the west side of Fort Collins. But a tornado came through just a little bit east of us, just a few miles east of us. It knocked down a barn and crippled a horse. The horse had to be euthanized. And the horse was brought into the main clinic. The ovaries were removed and brought out to us. And we were able to, and the generic we, that'd be Dr. Carnevale, a lot of other people involved in that, able to harvest oocytes from this particular horse. They had a couple stallions in mind, and we had semen shipped in from those stallions and did sperm injection on that. And then this was all done in a hurry, and because we didn't, this was not planned. It was just something that happened. And then we were looking for recipient mares for this, and they actually had trailers. The neighbors were bringing mares over to try to say, use my mare. I've got a mare. I've got a mare. And we ended up getting 2 pregnancies and 2 live foals from this catastrophic event for this family. And again, one of the more heartwarming things that I've ever been associated with is from a tragedy to 2 healthy, normal foals, and to be able to essentially give that life back to this family. It was just awesome.
That's amazing.
For those that are interested in clinical cases, I've got 4 ebooks that I've written, and they're free. And if you type in my name and put in Patrick McCue, equine reproduction, maybe ebook, there's a pair of textbooks in there, and then 2 clinical case books, which will have all kinds of fascinating things in there of cases we've seen over the last 20, 25 years. And it can be a real learning experience for both veterinarians and horse owners to say, hey, they're kind of the more fascinating things that we've seen. Some of the chromosomal abnormalities we've seen, where sometimes you get to think, somebody will call in and say, oh, I've got a mare that has, we've never bred her. She's the first time she's examined. You got tiny little ovaries. And I'm going like, I think I know what that's going to be. And then you end up doing a karyotype and find out something completely different. And you learn from that. So some of these, like opening a Christmas present, that you don't know what you're going to get until you take the wrapping off.
If veterinary medicine teaches you anything, it's that you never know quite as much as you think you do.
Yeah, well, we've all been humbled, and you've got to be okay with that. You've got to be okay to be wrong, you go down a pathway diagnostically. You've got to be willing to say, okay, we get the result of this diagnostic test, and even though I thought it was going to be, I don't know, an ovarian tumor, it's not. It's something else. And it takes you down a different pathway with a couple more diagnostic tests until you can get the final actual clinical diagnosis that sometimes it'll tell you that reproduction is really not possible. And other times it'll say, we know what it is. We can fix it. Yeah.
Well, it's a good reminder that veterinarians and doctors are, in fact, humans, but they just happen to be very educated, tenacious humans that are going to find the answer,
Right. And some of us in a very specific niche, right? And so, yeah.
I love that. So, Dr. McCue, what anyone who really knows you understands is that you are in academia for certain. You perform all of this research, but you also get your hands dirty with patients, like we've been talking about, just your average prosthetic leg on a mare, no big deal. But you are a passionate educator. And I love that part about you, because anytime, that you talk on this subject, I feel like everybody in the room is leaning forward because your passion for it is palpable. And I feel like that's when someone is in the right spot, is when you are so engaged and so enthusiastic about advancing knowledge on equine reproduction for other veterinarians, for breeders. I mean, it's you found your place, to be certain. After 38 years, you're in the right spot. But I really would love to know why. I mean, it seems like a simple question, but it's about as profound as it gets. There's a lot of different specialties inside of veterinary
Yeah.
medicine. Why this? Why are you so inspired, challenged, motivated by equine reproduction that you have made this your life's work? What's the
Right.
goal?
So I grew up on a small farm, a small dairy farm in a very rural northern New York, up near the Canadian border. And um, so I knew about cattle a bit, and we would obviously breed cows, and help deliver calves. And eventually, I was fortunate. I didn't think I was qualified to go to veterinary school, but I was fortunate to get accepted into UC Davis. And as a veterinary student, I I started going down the large animal pathway, cattle and horses, and I had opportunities that, partly because I'm a curious person, and I actually asked some professors at Davis, can I, would you allow me to palpate some cows? Would you allow me to palpate some horses? And thankfully, both groups did. And just by myself, Dr. John Hughes, which I really owe my career to, faculty at UC Davis, he allowed me to palpate a few mares. He said, you can pick 3 of the teaching herd. You have to tease them every day to a stallion. You have to palpate them, no ultrasound, and then take notes, and I'll check your notes. And the first few times I'm like, I can, maybe I found one ovary, but I couldn't find the other. And just every day I just did that until I could consistently palpate the ovaries. And one day I could feel the mare started coming into heat. That was obvious, but I could feel the follicle developing and then getting bigger and bigger. And the day she ovulated and that follicle collapsed, it was that, not just a light bulb, it was a bright light that came on. And I really said that I can do this. And I think that was in my second or third year of veterinary school, that I can do this. And everybody's got their specialties. And I early on, a lot of respect for surgery and medicine. I worked in equine radiology for a summer, equine intensive care unit for a summer, and they were all great. And I learned so much for so many people. But reproduction always had this, it's anatomy, it's physiology, there's abnormalities, and again, the diagnostic therapeutics, and they all have that. But that package just seemed to naturally fit. I was fortunate to do an internship in equine medicine surgery at the University of Pennsylvania, the New Bolton Center, and trained at Davis, became a veterinarian at Penn, with all the people there at that fantastic clinic that they have. And again, just able to move forward. Had a residency offered to me, and things just kept going and going. But I love the horse, and I love the people that own horses, and especially quarter horses. They're just growing up in a small town on a small farm. Quarter horse owners are kind of the same people that I grew up with. So it's been just a lifelong, professionally adult lifelong passion to help people and to try to facilitate clinical advancements, research advancements, and then the education. One of the most favorite things I do ever is to talk to veterinarians and horse owners. So I've had a great career. The highlight of my career, you brought it up earlier, was the Milne Lecture. When I was asked to what I consider giving the Milne Lecture to the AAEP, it was overwhelming. And at first, I thought, am I qualified? Could I do that? And they gave me 14 or 15 months advance notice, and over a year putting the talk together. Again, the highlight of my professional career was that, and I thank Platinum for supporting that.
Well, what a thing to watch. I mean, anybody who's known you for the years that we have, and all of your colleagues, it was a real special day to sit in the room and know, I've known a lot of Milne lecturers and interviewed a lot of Milne lecturers, Dr. McCue, and there's a common thread throughout is that these are, as I mentioned in the beginning, the worldwide authority figures on this topic that they're discussing. It's a huge honor. But I think every single one of them has that question, like, am I worthy? Do I really know enough to stand up there? And then the second step is they realize that they've got to do this hours long lecture with the largest slide deck they've ever put together in their life. And they go, oh my gosh.
Yeah. And to stand up at the podium, all I wanted to do when I stood up there is I tell people about other just basic things. If I can get the first sentence out, I'll be okay. But I'm going like, can I get up there? Because you look and the lights are coming at you. You can't see. I can see in the front row, and I know how big that room is. And I know there's a few thousand people out there. And then I'm going like deep breath and then just get started. And then just, it takes over. It just, you go into this role of an educator. And I know I've had enough experience in my life at that time because I'm talking about things that I'm comfortable with and know about in a lot of those cases and a lot of those people. So I did my talk was mostly on the history of equine reproduction and the people and the places that discoveries were made. And I was fortunate to be in an era where I knew some of the people at the end of their career, but I'd met them, I knew them, and it was really an honor to be able to talk about some of the people: Bob Kenny from Penn, John Hughes from Davis, Twink Allen from England, to be able to talk about them and remind people that those are the pioneers, literally the pioneers that set the stage for all of us. And it's that whole thing of we are standing on the shoulders of giants, and that quote has been around for a long, long time, and I feel like all of us have had that. We all have the predecessors in our life that were the foundation of where we were, and maybe then people in my generation have had a foundation for the next generation.
Yeah, well, you're now one of those giants, and it's true. So I can say it. You won't say it. You're a humble guy, but I can say it. And you are. And from our perspective at Platinum, it's been such a ride and so amazing to be able to be in this industry and to see how collaborative it is and to see all of this progress that's gone on, because it allows all of us to work in concert because we share this common goal, and it starts and stops with the horse, right? I mean, everybody is out for the betterment of the horse, whether that's equine reproduction, whether it's medicine, surgery, the evolution of rehab, any of these things. We're all out for the horse. And it's really amazing to be able to take these clinical needs, like aged and problem mares, the topic at hand today, and for people like us to be able to work with people like you and your team to tackle these clinical needs together and to really make progress. And, from our perspective, that's how things like Platinum Veterinary Reproductive Care, that formula, that's how that came to be. It was based on research done at Colorado State and the horse, and now we can go on to make progress together and to really impact real cases, which is so cool. But I mean, it's a life and a career that you should be immensely proud of to look back on that. And as much looking back as we've done, I want to look forward for a minute, because you've been practicing and researching and been right in the thick of it for 38 years. And because I know that you are in what we'll call a transitional retirement. I don't think Dr. Pat McCue will ever fully retire, but
I've heard that before. Yeah.
Yeah, weird. Anybody who knows you knows that's not happening. But talk to me about what's next, because you're going to be enjoying some hobbies for a change, but you've also got some goals left in front of you. So talk to me about what's next.
Right. So just to verify, I am in a transitional retirement. I've gone from working 100% time for the university to 50% time for a couple of years. And then, so it's still got more of that to do, another year of that. Then I'm not sure exactly where, from an academic standpoint, where I'll go. But one thing that I have been involved in, there's a group, the International Symposium on Equine Reproduction has been going on for a decade, since the 1970s. Once every 4 years, a major symposium that we present the active research around the world, and it's moved around to different places around the world. And that is being morphed into a society, and it'll be the International Society on Equine Reproduction. And it's a fledgling group right now. We're just getting started. We're so new, we don't even have a website. But in the next few months, we'll have a website and a membership drive. And the goal of this is global education. And we're trying to bring education in the world of reproduction and in the world of what we do. And there's people all over the world that are involved in this, from academic institutions to private practices, that want to advance. Really, it's the education to people, to veterinarians and horse owners, but in areas that don't have access to education. And there's a lot of people around the world that are very interested in reproduction and horse health, and that's who we're trying to reach with this. And so there'll be online platforms, there'll be regional educational venues. Again, it's trying to reach people around the world, not in any one geographic location, especially not necessarily in areas that have good veterinary schools and programs like the AEP. But that's right now. I'm the chair of the program, and that's going to keep me busy for a number of years. And again, there's a whole group of us that are involved in this. Certainly not just me.
Well,
That and fly fishing, and so I'll be able to get on the rivers a bit more than I have in the past.
Well, I love that. And, you say it's a fledgling group right now, but that's how these great ones start, right? I mean, that's how these amazing societies start.
Yeah.
And we got to be there from the beginning with your colleague, Dr. Mindy Story, who is also at Colorado State, as she and so many, Dr. Kevin Hausler, so many of these incredible veterinarians were forming the Equine Spine Initiative. It was the same process, know, and they go on to make, amazing discoveries and progress together. So I think that's really great. And I love how, you've been telling me, okay, I'm going to fly fish more. I'm going to travel. The travel part of it, ladies and gentlemen, tracking Dr. Pat McCue down to record a webinar or a podcast is tracking him around the world. So I feel like you already travel quite a bit. So so hopefully it's just a little bit more for pleasure than business these days.
More for pleasure, and typically right now around the Western United States. But my wife and I were talking last night about going up into the Northeast and being able to travel through Vermont and Maine and all of that. So we'll be in an area near you soon. Yeah,
amazing. You're talking to a newfound leaf peeper, it sounds like. So enjoy that Northeast. But Dr. McCue, are there any closing thoughts that you want to leave our audience with, whether that's veterinarians or horse owners, breeders, on this topic, on equine reproduction, on aged and problem mares?
Right. I guess part of it is that there's so much more we need to know. We think that we've never solved everything and probably won't ever, but I think we just need to keep pushing forward with, it's got to be basic research. It's got to be clinical research, and veterinarians in private practice can add a lot to this. They see a lot more cases than people in an academic institutions do, and a collaboration of people is really going to be helpful. And horse owners can get involved in this as well. And I think that. I'm just gonna say a collaborative work. We need to talk to each other and not just stay where we're at. That it's easy for anybody to say, I've learned this level and I'm just going to practice at that level and not advance my clinical skill set. But there's going to be advancements all the time, and we need to keep an open mind to all of that. So I think I'll leave it with that there will be advancements and we need to embrace it.
Absolutely, is to practice outstanding foundational veterinary medicine, but at the same time, always ask what's next. So
right.
I like that. And there you have it, ladies and gentlemen, straight from the man himself. And I want to thank my friend, Dr. Pat McCue, for being here to share a slice of his knowledge with us. So thank you, sir, for joining me today.
I'm thrilled. Thank you very much for the opportunity, really.
Well, there are many people who are knowledgeable on a subject, but it's rare to get the opportunity to talk with someone that has been so central to many of the major discoveries and advancements in this specialty like you have. And it was just an absolute pleasure to have you here and to get to learn from you, as I always do anytime I talk to you. And also to all of those joining me today to learn alongside me. I appreciate you being here to hear the great Dr. Pat McCue, discuss the subject that's so central to equine veterinary medicine. And I certainly hope you'll join me on the next one. But until then, I'm Jessie Bengoa. Take care, all.